Hey there folks, John Farahmand here from Balance Physical Therapy. Today I want to talk about your rear end. Well, maybe not your rear end, but rear ends in general. Specifically, I'd like to talk about a muscle called gluteus medius. We oftentimes see patients that have a weak hip girdle. And aside from just being a very important muscle that lifts our leg away from midline and helps to rotate the hip a little bit, what most folks don't realize is that gluteus medius is very important with regard to stabilizing our pelvis and our lower extremities while we're walking. For example, if you ever see folks out in the community that land on one foot and suddenly have a drop in their hip like this, they're not trying to look cute. They literally have a very weak gluteus medius. And so one of the best exercises that nicely isolates gluteus medius, although most folks think it's boring, it's actually very, very effective. It's just good old-fashioned side-lying hip abduction, or lying on your side and lifting your leg straight up and away from your other leg, which stays on the floor, in this case on the table. When we look at EMG studies, what we found is that gluteus medius has a really nice high level of activation when the hip remains in relative extension, as opposed to doing a squatting side step, for example, which has a high degree of activity in a muscle called TFL, which is a little bit more up front in our hips. And so what I'm going to show you here on the exam table today is how we as physical therapists like to recruit our patients' gluteus medius very specifically and at a very high level of specificity so that our patients can get the most bang for their buck and the most strength training effort isolated just to the gluteus medius muscle. Hey there folks, John Farahmand again from Balance Physical Therapy. As I was explaining just a moment ago with regard to isolating the gluteus medius muscle, which is an abductor, external rotator of our hip, but also a very important dynamic stabilizer of our pelvis and our lower extremity in the frontal plane. This is the exercise that I was mentioning, side-lying hip abduction. I think it's often overlooked because, let's face it, it's kind of boring, right? It's not sexy like a overhead kettlebell lunge or a squat or sidestepping with a band around your ankles, but it is very, very effective, and it's simple and you can do it anywhere. So in clinic, when we're working with patients and we're working with strength training clients, the way that we like to isolate gluteus medius is by making sure that the top hip is just slightly ahead of the bottom hip, and that helps to prevent the hips from opening up and from patients substituting with lower back or lumbar extension. And then just give a little cue here and come straight on up with that top leg, straight into abduction. And what I'd like you to do is resist on the way up and resist also on the way down. So we get a concentric or shortening load on the way up, go ahead, and an eccentric or lengthening load on the way down. Keep going, straight up and straight down against resistance. Good, straight up. And I'm just giving a little cue with my thumb so she knows exactly where to isolate. Great work. And if we wanted to add one more layer of difficulty or complexity, we can bring in that little rotational component of the gluteus medius fibers, and we can actually cue our patient or our client to abduct and externally rotate at the same time. And again, concentric on the way up and eccentric on the way down to really, really drive as much blood into that muscle as we can and recruit as many muscle fibers as we can. So you ready to work? Yeah. Okay. We're going to come up and externally rotate at the same time and resist down. Up and externally rotate and resist down. Up and externally rotate and resist down. Good. Keep going. Couple more. You're already starting to fatigue, aren't you? Up, 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 up. So very specific, very, very difficult, but extraordinarily effective at isolating one of the most important muscles in the hip girdle, the gluteus medius, which again, it's important to move away from midline for our hip in an open chain environment when our foot is free to move, but in a closed chain environment, for example, when we're locomoting or when we're walking, it is very, very important for dynamic stabilization of the pelvis and the lower extremity in the frontal plane. So go after your gluteus medius, ladies and gentlemen. Side-lying hip abduction, it might be kind of boring, it's not real sexy, but it's very, very effective and it's extraordinarily important for the health of your hip girdle. Thank you.